everyone. Can you hear me? Is it on? Now it's on? Yay. Not yay. This is awkward for me. Hi, everyone. I am Stephanie St. Joseph. I work at the May Institute outside of Boston. We are a national autism center, and we're also one of the technical assistance partners for the National Center on PBIS. I have a background as a school psychologist. I was a school psychologist for 10 years in a large district in North Carolina. And then I went to the University of Oregon to get my PhD in special education. When I was a school psychologist, I was in charge of training multiple schools in doing MTSS. It was RTI at the time. That will tell you a little bit about how old I am. I have anxiety, and I am presenting about anxiety today. I feel very strongly about mental health for our students, specifically for students with disabilities. That's what my dissertation was on. But I think, especially since the pandemic, mental health is such an important piece that we've been missing with our kids historically, but especially since the pandemic. And I know that during the pandemic, my anxiety was heightened, as I'm sure all of you were. And so that's what I wanted to kind of talk about today. So I think it's funny that today I was looking through the list of presenters, and every single one of the presenters today graduated from the University of Oregon in the special ed department. Because we're amazing and we're fantastic. So please bear with me with my anxiety as I present. Thank you so much for being here. If you do have a question, just raise your hand up, go to the mic, let me know. You can do it in the middle of my presentation. It'll be a good reminder for me to stop and take a breath, because sometimes I forget to breathe when I present. So yay. Okay. I wouldn't be a good educator if I didn't have an agenda for the day. Here it is. We'll go through it. And then I wanted a slide just of all the acronyms that we use. Melissa just used an acronym that I had no idea what it means. I think it's specific to Michigan. I don't know what a SCECH is.
State Education Clock Hour.
Okay. That makes so many acronyms in education. And so in case I do use acronyms in my presentation, I kind of just wanted a preview of what some of them were, because we all get into the jargon of the education world when we start talking. So, okay. Do you have devices in front of you? I want this to be interactive. So if you would go to pollev.com/SStJoseph640, or you can text SStJoseph640 to 22333. And then I just want to get a feel for who is here today. This will take a couple minutes for you to log in. There's two different ways. You can go to pollev.com or text. St. Joseph, no period. So I am a saint, y'all. My last name is St. Joseph. My undergrad was St. Lawrence University. My graduate school was St. Rose. I'm a saint 3 times over. And then I became a duck. I'm a saintly duck. It's working. So we have a lot of support personnel here. We have some others. We have some general education teachers. If you are an other, would you mind letting me know what that is? Consultants.
Building
Principals. Oh, I thought I had an administrator in there. I didn't. I'm so sorry, administration. She likes being other. Okay. This just gives me a good feel for who's in the room, so I know what to spend more time on in certain pieces. I think it's good for everyone to kind of know who's in the room. Do we have any BCBAs in here? Cool. I'm good with that. Okay. Okay, keep your poll everywhere open, because we're about to have another one. What is anxiety? I bet you want me to tell you that. I'm going to have you tell me that. What is anxiety? And it's going to come up as a word cloud. What do you think anxiety is? 1 or 2 words. If you use more than 2 words, it might separate. What is anxiety? I see stress a lot. I see fear. I fear uncertainty. I see worry. I see behavior, intrusive thoughts, irrational, overwhelmed, change. Yeah. Ooh, this is a good word cloud, everyone. Good job. Yes, anxiety is all of these things. It's a kind of all-encompassing, I don't know what that is. It's an all-encompassing kind of phrase that people use kind of willy-nilly. Anxiety is an emotion characterized by feelings of tension, worry, thought, and physical changes, such as increased blood pressure, increased cortisol. I have a big stomach because I have a lot of cortisol because I have anxiety. I don't know why I just said that in public. I have anxiety, and so I lost my filter. So here we go. Everyone experiences anxiety. Every single person does. And anxiety in and of itself is not a bad thing. We need anxiety to survive. If you were, back in the old ages when dinosaurs roamed the land, if you came across a dinosaur, you would experience anxiety for your own safety. If you did not experience anxiety, you might just sit there and get eaten by the dinosaur or the bear or the tiger or whatever. And so anxiety is necessary for us to survive. That's why it exists. Sometimes we have anxiety that kicks in a little bit more often than just for survival mode. So we all have anxiety, and that's totally fine. It's totally normal. I am proud to say that I have anxiety. I want to normalize it as much as possible because so many of us struggle with it. But in and of itself, it is not a bad thing. It's to the point where it impedes or impacts our ability to function that it becomes a bad thing. Within our children, 1 in 13 children have it chronically, and that is an old statistic. It is much higher since COVID. But with that, only 1 in 3 gets treatment for anxiety. It is the most common and pervasive mental disorder in the nation. That's why we're talking about anxiety today. Here's a nice little visual for you. I like to do yoga, but trying to do that mindfulness, some of these thoughts come in my head. My favorite is the last one. Should I have peanut butter cups for lunch? Yes. Yes, you should. But then I'll have guilt about having peanut butter cups for lunch, and there's just a whole cycle. It's a thing. Here's another visual that I really like that shows the stress response in kids. We are all familiar with fight or flight. When you experience a situation in which you may be in danger, you will either fight back or you will run. Recent research looks at also the freeze or fawn phenomenons, and so there's just some descriptions underneath for what each of these are. So fighting is pretty much what you would think it is: yelling, screaming, kind of like externalizing defiant behaviors. Flight is wanting to escape or run away. That's me. Being unfocused, difficulty paying attention, being fidgety or restless, and then the freeze is just shutting down. Your mind goes blank. When that glass starts to fall and you see it and you just stop and watch it instead of trying to catch it. That's an example of freeze. And then here's another visual about anxiety. And this is related to the cognitive behavioral therapy model, which is you have thoughts, you have feelings, and you have behaviors, and they're all connected. So if you have a thought, it affects how you feel, and it affects how you behave, and they're all connected. So with anxiety, you have to think about what is going through someone's mind, what is going through a child's mind, and how is that making the child feel? What are the physical symptoms, the somatic complaints, and then the behaviors? What does the child do? How do they respond or cope? A lot of times when I think about this CBT model and the thoughts, with anxiety, there is something that we call automatic thoughts. And those automatic thoughts can often be very negative. And we spend more time processing negative thoughts and feelings than we do positive ones. So if someone gives you a compliment, it's really easy to brush it off and be like, they're just being nice. But if someone says something bad to you, you tend to ruminate on it much more. So negative thoughts, I was sitting at my table and not able to eat my breakfast because I was having anxiety, and I was trying to count about how many people are in the room, and I was thinking, I'm going to make a fool of myself in front of all of these people. I am wasting their time. They came to have a good breakfast, and they're all going to throw it up on me because I'm terrible. That is like the thought that went in my head. And then I have to stop and think about it. And like, Stephanie, they're not going to throw up on you. It's just not going to happen. In actuality, I am here speaking about this because I know about this, because I have expertise on this. I've done research, I've read articles, I know what I'm talking about. I am also charming and delightful, and these people are going to love me. Thank you. Thank you. Thank you. But if you think about those thoughts going through my head, did not make me feel any better. Those, the last thoughts, the first thoughts about you throwing up on me did not make me feel any better. And so I was feeling bad. I was feeling more anxious. I was not able to eat. That was my behavior. I was sitting at the table going, oh, I don't want to do this. That was pretty. I'm so sorry about that. And so that's what the cognitive behavioral model is. And specific to anxiety are those automatic thoughts that are often distorted or negative. And if you are like me, you're probably thinking of some of the children that you work with and how this might affect them, but you're also probably thinking about yourself in this, and that's fine. Do what you need to do to make this meaningful. We all have anxiety. We all do this. It's normal. It's fine. I'm going to help you with it, I hope. So anxiety and child development. Different stages of child development have different types of anxiety associated with them. So babies, usually about 6 months old, will start to have separation anxiety. Moms do, is that about right? About 6 months old? And then usually into preschool, kids will start to have like specific phobias. That will be more nightmares at night, and then specific phobias about having monsters under the bed or being kidnapped, a lot of weather type of specific phobias. And then as we get into adolescence, it becomes more social anxiety. How do I fit in? What do others think of me? How come I'm not cool or popular? But then there's also selective mutism. There's obsessive compulsive disorder, which we see a lot more in girls than in boys. All sorts of different types of anxiety are prevalent through all stages of child development. And there's also a lot of co-occurring diagnoses with anxiety. I've heard people say that, excuse me, I should have brought my water up here, that anxiety is worry about the future and depression is worry about the past. I've heard that. It makes kind of sense, but not entirely. But there's a bunch, so we do think about depression, but there's a lot of other co-occurring diagnoses like these up here. A lot of somatic complaints. Oh, thank you. Thank you so much. I feel like powerful now. I wish I had $100. Sorry about that. I tried. You miss 100% of the shots you don't take, right? Anxiety also has a lot of co-occurring diagnoses like somatic complaints. So things like headaches, irritable bowel syndromes, sleep disorders, having chronic pain, those are all things that are related to anxiety. I know that the more anxious I get, the more upset my stomach becomes, which is why I did not eat my breakfast. A lot of times people with anxiety can't sleep at night because their thoughts don't stop. They're just ruminating on the events of the day or about the next day, like presenting in front of 100 and some people, something like that. So there's a lot of co-occurring diagnoses to think about when we're thinking about anxiety. What are the symptoms of anxiety? I talked about some of these before, inattention and restlessness. Specific to children in schools are attendance problems or having clinginess to adults. It might be their parents, it might be to a preferred teacher. It could be trouble answering questions or difficulty participating. Frequent trips to the nurse is a sign that we look for, not turning in work, avoiding socialization or group work, and then disruptive behavior. Disruptive behavior is the easiest for us to see, so it tends to be where we spend the most of our resources, our time. We have to think about, though, that disruptive behavior is often generated by unrecognized anxiety. A child who appears to be oppositional or aggressive may just be reacting to anxiety. They may, I'm sorry, I'm giving a lot of examples, but I don't like being in front of people, but here I am. I have stage fright, and as a child, I took piano and voice lessons. We had recitals twice a year. Every time I had a recital, I would make myself sick because I was nervous. And there was one point where my song had changed just before the recital. I knew I didn't remember the words, and I fought with my parents right before the recital because I was so nervous. And that was the disruptive behavior because I knew what was about to happen. That's an example of that disruptive behavior. I couldn't articulate effectively what it was that I was feeling, and so I just kind of reacted by fighting back to my parents. So that's the fight, flight, or freeze instinct. This is what we tend to see a lot of. In PBIS, we talk about office discipline referrals, which tends to be more externalizing behavior. I want us to focus more on the internalizing behavior. Let's look at that and the core of that, where it's coming from. So internalizing behaviors, when we say a child is anxious, depressed, or withdrawn, we're saying that they're crying often. We're seeing somatic complaints. We're seeing a lot of those negative self-talk statements that I talked about, asking for frequent breaks, wandering the halls, that's avoiding. What we're not seeing them participate. We're not seeing them be socially active. We're not seeing them begin or complete their tasks. And so it's important to think about what we do see and what we don't see when we're thinking about this. It's also important to think about the antecedents and the consequences. So what's happening prior to the behavior? It could be transitions. We know that those unstructured times are often anxiety-producing for our children. It could just be touch. For children that have trauma, just like the teacher touching their arm as they walk by might be an antecedent, might be a trigger for them. It could be tone of voice or nonverbal cues. Someone who has their arms crossed, looking around the room, they might not think anything of it, but a child may view that as someone being upset and causing them anxiety. And so the consequences of what follows the behavior, we know that students are usually avoiding because they're trying to avoid those feelings related to anxiety. They're trying to avoid those things that cause them anxiety, social disapproval. We know that internalizing behavior is maintained by escape or avoidance. And so we look at that escape or avoidance. What are they trying to escape from as the consequence? Here are two quotes that I really, really like that talk about anxiety. The trouble is that when kids who are anxious become disruptive, they push away the very adults who they need to help them feel secure. And instead of learning to manage their anxiety, they end up spending half the day in the principal's office. Is that what we want? It's not what I want. When a teacher understands the anxiety underlying the opposition, rather than making the assumption that the child is actively trying to make them miserable, it changes the approach. If it sounds labor-intensive for the teacher, it is, but so is dealing with the aftermath of the same child having a meltdown. So a lot of the work that we do has to be front-loaded. It has to be proactive. We have to do a lot of things up front to be preventative so that we're not spending as much time being reactive to some of these behaviors. What do? We do PBIS, we do MTSS. By implementing the core features, we can create a more stable and predictable environment and features of a school that promote healthy social and emotional functioning. Remember that the goal is never to eliminate anxiety. We never will. Anxiety is always going to be there. We just have to know how to manage it better. Anxiety and PBIS, an in-depth study found that students with internalizing behaviors such as anxiety are the most responsive to PBIS. They experience the greatest gains in their grades and the greatest declines in the numbers of suspensions and behavior challenges. Despite these advances, school teams implementing PBIS sometimes overlook teaching super important social emotional competencies. We have to think about the fact that we're not just teaching reading and math. We're teaching social emotional behavior all day long. Every interaction we have with someone is impacting their social and emotional behavior. Is it okay that I'm saying PBIS? Okay, I know Sometimes people don't know the phrase. I just wanted to be sure. Okay. So the purpose of PBIS is to make schools more effective and equitable for all students. So having predictable environments, having consistency between the language that teachers are using, between their expectations, between consequences, focusing on more positive environments, safe environments, and equitable environments, all of this supports mental health. All of this, I say, yay. Do you say yay? Yay, thanks. Thanks for that. Y'all are so nice. Thank you. So anxiety in the tiers. We're going to talk about tier 1, which is supports for all, tier 2 supports for few, tier 3 individualized supports. If you're here at this MTSS conference, I assume you know what these tiers are. Yes? Okay, cool. Okay, another poll everywhere, just in case I was losing you. How many of the youth that you work with require tier 1 for anxiety? It's kind of a trick question. All of them. A handful, the majority. The majority is spelled wrong. Stephanie. Well, tier 1 is for all, so we assume that most of the students in tier 1 are going to respond to this. But we know that tier 1 is like 80% of the children that we work with. Most of the students that we work with will have anxiety of some sort or another. Even those who we don't think of as anxious are going to have moments of anxiety. If you think of the end of the year tests, something like that. That's why this was a trick question. I'm sorry about that. Through PBIS, schools should have clear and consistent behavioral guidelines. So for students, knowing exactly what the expectations are in every setting of the school. So in the classroom, I can speak at a voice level 3, but in the hallway, it should be a level 0. In the cafeteria, it could be a level 4. When I'm in the hall, if I walk on the right side of the hall, knowing what those expectations are in every setting, having the same language, having the same consistency is going to be super beneficial for our children. They know what's expected of them. They know what to do there. That helps us. That's why we all have planners and agendas. Knowing what to expect of our day is super helpful for us. Having a feeling of safety, having a trusted adult in the school. It could be their primary teacher, it could be a special teacher, but just having someone there that they trust and they know that they can go to is going to be very helpful as well. The school climate, knowing that equitable discipline, that if Johnny and Amy both do the same behavior, they're going to have the same result, that also helps. This is a very protective factor. When we talk about, bless you, when we talk about tier 1 implementation, in PBIS, we're talking about expectations, having those expectations visualized throughout the school, defining routines, also acknowledging our students. We say, there's that phrase that you can do 100 things right, but it's the one thing you do wrong that gets noticed or pointed out. And then that's true for us as adults who work, but it's true for our students as well. We get so used to correcting, and that can cause a lot of anxiety. But if you start to point out the positive, that's really going to help be a protective factor and improve school climate. Teaching, practicing, reinforcing social and emotional behavior helps to prevent challenging behavior and creates a strong foundation for students who need more intensive support. I am so big on the proactive and the preventative stuff. And so this is why I say, like, we're going to front load this. We're going to put a lot of work in to do, create as a positive environment as possible so that when we do have students who need more support, we are better able to help them. So the foundation, maintain usual routines. I said a lot of this already. Clearly communicate those routines, set clear limits, and develop logical rather than punitive consequences. Consequences don't have to be suspension or out of the hallway or being yelled at. It could be a conversation with a teacher, like a restorative practice. Why are we having difficulty with this? What can we do to make this better for you type thing. Supporting all children to feel safe, physically, socially, emotionally, and academically. providing advance notice of changes from the routine, and addressing students' needs in holistic ways. I think we kind of come into our jobs with a lot of assumptions that our students had a full belly or a full night's sleep or a good positive morning with their parents, and that's not necessarily the case. And so thinking about a child holistically, considering their strengths instead of what their needs are, is gonna help as well. When staff notice students struggling in the classroom, do a self-check, have a feelings thermometer. Are you guys familiar with feelings thermometers? It could be a scale of 1 to 10. It could be different smiley faces like they have in the doctor's office. Just having students check on that and making that part of your routine, like they each have a thermometer or they do a fist of 5. Let's do a fist of 5 right now. 0 fist is that you have no anxiety and you're feeling great and loving the session, and a 5 is you want to walk out the door and go to your room and cry. How are you guys feeling? Oh, I love the fists. Make love, not war. Yes. I don't know why I say these things. I'm so sorry. But having our children do these self-checks and doing them routinely every day not only gives us insight as to how they're feeling, but is also teaching them to self-monitor. So, okay, so my shoulders are hunched up and my stomach hurts. Why is that happening? Oh, I'm also feeling like a 3. They're starting to make some of those connections. It's good for everyone to practice calming breaths. It's good for everyone to have movement breaks. And it's good for everyone to have advance notice of transitions. These are things that we can do for all of our students that are going to help them with anxiety. For our students that have supports that have some more needs beyond that, we're going to talk about their Tier 2. So how many of the youth that you work with in Tier 2 require some supports for anxiety? This is not a trick question. Okay. It's fun to see those bars move. Okay. So we're seeing very few of a very few. We're seeing a lot, like about half, a handful, so good. Okay. So teaching social emotional based competencies. This is Tier 2. These are those students who those overall universal things that we put in place aren't necessarily working. So we need to help teach some more social emotional based skills. So it's teaching self-regulations and routines, things like focused breathing and taking a break. And it could be a lot of skill-based groups, like self-identification of thoughts and feelings, identifying what the perceived threat is. What is it that is making you anxious? Social skills for forming and strengthening relationships with adults and students, and a lot of self-monitoring to identify and adjust appropriately, which is what we want our children to be able to do eventually. We may have to teach them how to do that. So here's an example that we can do in Tier 2. We can do this anywhere. I did this in my dissertation. I had students that I worked with, and each of them had like a favorite technique, and these were some of the techniques that they liked, and so we're going to practice them right now. So robot ragdoll. I had to learn on this one that children today don't know what a ragdoll is. So I had them think about at the car dealership, those things that wave around in the wind. Everyone knew what those are. I don't know what the name is for those. So robot ragdoll. So first we're going to pretend that we're a robot. We're all going to do this, so get ready. So you're going to be a robot. You're going to be really stiff. You're going to clench your fist really tight, and you feel that tension, and make every muscle in your body super, super tight. Hunch your shoulders, clench your butt, make everything really tight, and then when I say go, we're going to become a ragdoll and just let everything loose and wave around. In 3, 2, 1. How's it feel? Okay, be a robot. No, sorry. Robot. That was my robot dance. And a ragdoll. Do you feel the tension relief? It feels good? All right. Okay, deep breathing. What I would do with my students is they each had a feelings thermometer that they helped me create. So they created it according to their interests. So I had a superhero thermometer, I had a Pokemon thermometer, I had cat thermometer. And so if the little girl participant had the cat thermometer and she was saying she was at a 3 on her cat thermometer, I would say, okay, so we're going to take 3 cat breaths. And we're going to go from a number 3 cat, take a deep breath, down to a number 2 cat, take a deep breath, down to a number 1 cat. Let's just take 3 deep breaths all together right now. We're going to breathe in through your nose. Keep holding it. Keep breathing in. Hold it. 1, 2, 3. Let it out in a big sigh. Okay? We're going to do another one. Hold it in. Breathe through your nose. We're going to hold it. 1, 2, and let it out slowly. One more. Take a deep breath in through your nose. Keep breathing. Hold it. 1, 2, and let it out in any way you choose. How y'all feeling? Good. And then the 5 senses is personally my favorite. So this is kind of like a mindfulness activity. So together, 5 senses. Look around and name 5 things that you can see. Name 4 things you can touch. Name 3 things that you can hear. 2 things you can smell. And 1 thing you can taste. Whatever your mouth tastes like. Which is probably coffee or something like that, which is delightful, I'm sure. These are all activities to kind of just bring us all back into the moment because it's stopping those negative thoughts. It's stopping that worry about the future. Did you have a question? Okay.
We have some questions online. Is it okay if I ask those?
Absolutely.
So one of the questions that came up is, what about high-functioning students that have anxiety? Are the strategies and approaches the same?
Yes.
Awesome.
The symptoms will look different, but strategies and approaches are the same.
And do you have any specific suggestions for resources for addressing and supporting anxiety for students with autism spectrum disorders?
I absolutely do because that was what my dissertation was on.
Awesome. And then the last thing is, where did it go? Hold on. Sorry. They wanted you to know that it may be called other things, but one name is called air dancers for those big things in front of the car dealership.
Oh, air dancers. Okay. Cool.
Thank you.
Yes. Yes. Email me if you do want resources about anything anxiety specific to autism. I have a ton of them. My email is on the slides. I'm happy to share any resources. So, yes. Thank you. So within Tier 2, we also think about check-in, check-out, which is where a student checks in with a trusted adult every morning, and then at the end of every day, it gives them regular feedback and acknowledgement from adults. And it's kind of creating relationships there. It's also good for regular home and school communication, and it's good for self-monitoring, so helping our students really know what to work on, what that looks like and feels like within themselves. And we know that research has shown that adaptations of a formal check-in, check-out are effective for improving academic and social behavioral skills for students. So check-in, check-out increases active listening, seeking help, participation, self-monitoring, and the tools can be cognitive behavioral strategies. It can be peer mediation with older students. It can look like a lot of different things. These are some of the adaptations. Again, I'm realizing that I'm running out of time a little bit, and so I'm going through this a little bit quicker, but if you have more questions, feel free to email me. I am happy to answer. And then Tier 3, we're going to skip this poll everywhere just because of time. But Tier 3 is for students who require those more individualized supports. We know that as the same as with externalizing behaviors, we need to look at the function of the behavior when we're looking at Tier 3. What is the student communicating through their behavior? What is the behavior telling us? And so in Tier 3, this is where we tend to do a functional behavior assessment. We're looking at the function. Okay, so a student has anxiety, and the function of that is usually to avoid or escape. But what is it that they're trying to avoid or escape? Why is it that they're trying to avoid that? Do they not have the skills that they need? And so how do we address that? These are the main functions of behavior. Like I said, with anxiety, it tends to be avoidance and escape, but it could be any of these other things as well. it's just good to know what they all are, keep them all in mind. Sometimes we have students who have multiple functions, and that's important to think of as well. And then we want to use these FBAs to develop behavior support plans that are strength-focused, that we're trying to prevent challenging behaviors, teaching the skills that our students need to be successful, teaching them how to manage their anxiety, knowing when it's starting to approach, knowing what causes them anxiety, knowing what those negative thoughts are and how to counteract them, and then replacing those negative thoughts or those negative skills that they may have with better coping skills. And that way we'll see hopefully less challenging behavior. Prevention, this is all prevention, teaching, reinforcing. These are all related to the FBA. And I'm skipping through these because I wanted to get to, let's do this poll everywhere. After hearing all of this information, do you think more of the youth that you work with could benefit from Tier 1, Tier 2, or Tier 3 specific to anxiety? I'm going to give you 10 seconds to do this one. Maybe we don't need 10 seconds. Yay, 100%. We have work to do. Does that cause you anxiety? A little bit. And be honest, were you thinking about yourself and your own anxiety during this presentation? Yeah. That's cool. I'm fine with that. We don't have to see the answers. I was just trying to be silly. So next steps, we need to provide professional development in identifying internalizing behaviors. As a field, this is not something that we have really done a great job in. We tend to look at more externalizing behaviors. That's what we think of a lot when we think about challenging behaviors. We need to look more at the internalizing, being able to just even define what internalizing behaviors are. There's a research sample where we asked teachers to identify anxiety in their students, and they were actually highly accurate at identifying anxiety in their students. And so I think this is something we need to use more when we're working in the schools. How do we screen for anxiety? Well, here's a bunch of examples for you. These are a bunch of screening tools that are used. I use 4 of these in my dissertation. I use some of them that are specific for children with autism, and I can share those resources as well. But I wanted to go through them. So this is the SCARED, which is the Screen for Child Anxiety-Related Disorders. It's free. And I wanted to share this stuff with you because there's a lot of free stuff that you can use. There's a hyperlink there that goes to the form and also tells you how to score it. And I just gave you a little picture of what it looks like. For students with autism in my dissertation or students with communication needs, instead of maybe having them read it, I read it out loud to them with a visual picture as well to help them understand. One thing that I noticed too is that after an intervention with anxiety, these scores changed mostly because of the children's understanding of what a lot of these terms were. So that's some of the social skills that we need to teach as well. This is the general anxiety disorder. It's a quick 7-point scale. Again, there's a hyperlink, and again, it's free. This is the intolerance of uncertainty scale. When I keep talking about escape and avoidance, a lot of that is intolerance of uncertainty, not knowing what's going to happen and not being able to handle that. So this is another free scale that we can look at. Another one is the SPENS, Children's Anxiety Scale. And then there's the RCADS. Again, it's free. And all the hyperlinks are there, so you have access to these. Excuse me, this one is not free. This is available through MHS.com. This is the MASK. This one I put in here because it aligns with things like the Connors or other type of rating scales that people may use. Also, I know that there are rating scales like the BASC that include internalizing behaviors, but these ones are specific to anxiety, which is why I put them here. If your school uses the BASC or the BASC, absolutely use those, but if you have students who you might need to do some more in-depth investigation on, these are all things that you can use. The BEC is also free. And then what do we do now that we've screened our students? We've screened students, we see that they're at risk or highly elevated for anxiety. Now what do we do? Well, there's a lot of social emotional learning curriculums that we can use, and I'm gonna go over some of them here. Some of these are free, some of these are not. Coping Cat is a CBT curriculum. I used this in my dissertation. I adapted it for children with autism. It's for children 7 to 13 years old, and it's 16 sessions. The first half of it is looking at the psychoeducation. What is anxiety? How do you know when you're feeling anxiety? How do you know what those negative thoughts are? How do you investigate those? And then the second half of that is exposure. So exposing the child to things that cause them anxiety so that they can feel success and know that they can manage and overcome it. There's also a brief version available that follows the same format. There's a computer version, and then the CAT project is very similar, but for children 14 to 17 years old. You can find a free PDF of the workbook online, but I recommend obviously buying it for the publishers because it also comes with a manual for yourself with tips and tricks, but also a parent companion, which I think is super beneficial. Getting parents involved in that learning I think is super helpful. Strong Kids. This comes from the University of Oregon. There's different books for different grade levels. Again, this follows kind of a CBT type approach, but it also has like workbooks and activities for students to do. It also has a parent component to it as well. Match ADTC. This is a computer-based program that kind of follows I want to say like a flow chart, but as the child does activities, it takes their responses and then kind of gears the rest of the activities according to their previous responses, which I like. But it is computer-based, so you're not giving as much instruction. The computer is guiding it, but there's an example and there's a demo online for you to kind of play with and see if this is something you would want to do. The anxiety workbook for teens, I kind of did a little screenshot of the beginning of the table of contents. This is free. You can find this PDF online. And it goes through a lot of different activities, teaching about what anxiety is and how to overcome it. These are only some of the examples of social emotional curriculums. If I go back, there's a bunch more here that I can give you more information on, but just for time's sake, I just wanted to go over some of the ones that I know and like. So why should we think about anxiety in schools? Well, our children are in school. That's the easiest way for us to access them. A lot of our children's anxiety comes from things that happen in school. And so it's best to kind of address the anxiety in the context of which it occurs. It's also free through schools, which means that it's more equitable, that all of our students are able to get access to this. Instead of having a parent have to drive and pay for a therapist, we have supports in schools where we can address anxiety. There's less stigma as well. Like that research article I mentioned, teachers are really good at identifying and knowing their students. Also, part of the exposure piece is getting to practice in that real life context, which is super helpful. And it's immediate and daily access. I think school is the best place to address mental health, specifically anxiety for our students, for a multitude of reasons, and here are just some of the few. So how do we connect MTSS with school-based mental health? I don't know why there's a blank screen there. Through the Interconnected Systems Framework. This is PBIS and mental health and MTSS kind of all together. It's what we call wraparound services. So we're connecting all of these services to get that more holistic approach that I was talking about. We're aligning social emotional behavior initiatives through one system. We're aligning all of these systems that we're using to work smarter, not harder, excuse me. And so I really love kind of that work. Getting to this point is difficult, but it's something that I really encourage and I think is beneficial. I work with a school district that does this, and it's amazing to me. When I was a school psychologist, trying to get MTSS implemented, trying to get mental health addressed in students was so difficult. I was in North Carolina at the time, and to see the school district in Massachusetts like doing this, I'm like, it can happen. It can happen, y'all. We can do this. And so I really like kind of just aligning everything to really benefit all of our students. The benefits of ISS is we're uncovering students with mental health needs earlier. We're linking this to evidence-based interventions. We're keeping data to receive, to make sure that our students are improving, and so we can adapt if we need to. We're using the expertise of all of our school supports. As a school psychologist, I was in a district that was pretty much place and test for special ed. But I was trained in counseling. I was trained in mental health, and I thought it was a pity that I wasn't able to use that skill. And so this is using everyone and the expertise of everyone in the building. Here are some resources specific to ISF if you want more information on that. I'm giving you so many resources. And then the PBIS Center has a lot of resources as well for teaching social emotional learning. This one, the supporting and responding to students' social, emotional, and behavioral needs, takes you through each tier, gives you examples and non-examples, and then gives you resources to connect you to other things that you might want more information about. I really, really love that one. And then there's a bunch more references and resources here. I'll keep it there, and I wanted to save a little bit of time for questions. I went really quick.
Oh, we have some questions online, and then folks in the room, if you want to come up to the mic. Oh, you can go first.
I just wondered, I know you recommend it to be done in the schools to help anxiety. However, when do you recommend people go see a private practitioner? Like, do you ever recommend that, or do you, for outside therapy?
It's a case by case. You have to know the student. If they're responding well in the school, then by all means keep it in the school. If they're not responding well, it may be for a variety of reasons. Maybe they need more than what we can provide in the school, and that would be a good time to refer to an outside practitioner. Mm-hmm. The reason I like ISF is because we have relationships with those outside practitioners. So we know we have relationships and we have trust and we have communication between them, because I think that's super important. A lot of times when we see children behaving differently at school than at home, and we can do things at school that will help at home, but sometimes that parent needs a little bit more instruction and help at home, and so that would also be a good time to go to an outside practitioner that can go into the home, perhaps. That's a really great question.
The other thing I wanted to know is when, if ever, do you suggest medication, or do you not suggest medication for kids with anxiety?
I can't prescribe medication. I don't want to say that. I'm on anxiety medication.
Mm-hmm. Yeah.
It works for me. No, it doesn't. No, it does. It does. That's why I'm here. That is a very personal decision for parents to make for a variety of reasons. Same thing with ADHD medication. There are some instances where I've seen a child go on it and it's like day and night. Just like any medication, it can take some time to figure out what works, and that's really scary. That's a case by case. I'm not opposed to medication. I just want everyone to think thoughtfully about that decision. Thank you.
One of the questions online was, are the recommended SEL curriculum in your presentation, were they selected specifically for anxiety supports?
Yes. They are good for all internalizing behaviors and social emotional learning, but like Coping Cat specifically is for anxiety and depression. There's a lot of overlap between anxiety and depression, and so they can work for both, but the ones that I put in there, I like specifically because of how they address anxiety.
Another one that was online was, could you repeat the age group for the match ADTC?
Not off the top of my head, but I can go back to, I don't have it on here. I believe it's for all grade levels in school. So I think it's like 6 through 18, but don't hold me to that.
Okay, thank you. Oh, one more online was for students receiving Tier 2 or Tier 3 supports, would you recommend looking at screening for code disorders?
Yes. Yes. If I would recommend screening for all mental health, and you will see code disorders. I think it's really important. I'm really big on looking at the whole child, looking at the strengths, looking at everything that we can so we get the best picture. If you do suspect something else, absolutely do a screen for it. More information is better than none.
Awesome. Another question was, do you have any recommendations about how to address some of these things at the secondary level? Like how would you make some adaptations given that they're a little older?
That's a really great question. Students in the secondary level, their brains work differently, but that doesn't mean that they don't need this support and this help. The reasons that adolescents are so much of risk takers are because of the way their brains work. They need more reward. They need more help. They are dealing with so much like hormones and body changes and different expectations, but they still need this help and this learning and support with their social emotional skills. I like the Strong Kids because it has a specific book for secondary level. I absolutely think it is harder to do some of this work at a secondary level, but it is absolutely necessary. I love the Coping Cat in that it has a project for children 14 to 17 years old. And so there are programs that automatically adapt for the age level. I love Coping Cat because it's meant to be flexible. It says in the beginning of the book, in the manual, like it's meant to be flexible. You want this to meet the needs of the students. And so it gives you ideas for how to be flexible. And there's a lot of different things you can do. Like I was saying about the emotional thermometer, that's still beneficial for secondary. It's beneficial for adults. Incorporating their interests as much as possible, really getting to know the students, doing like preference assessments to figure out what they're interested in and making that part of the curriculum is going to be really beneficial. In secondary, often I wouldn't call it counseling or therapy because that in and of itself causes some social anxiety and stigma because of high schoolers. But it could just be like calling it psychology or something like that. There's a lot of adaptations that can be made, and I'm happy to talk more about that. But I love that there are curriculums specific to secondary because we definitely need to address the secondary.
Another question that came through was, if you're in a school that's not currently implementing PBIS school-wide, what would your recommendations be for a classroom teacher to do in a proactive way in their own classroom?
They can still do, if they go to like the PBIS website, they can still put things in place like having the schedule on the wall and letting students know when transitions are happening, really focusing on that positive acknowledgement instead of correction. Really working on relationships with the children is going to be the best thing for them and for your job as a teacher. And so you don't have to be implementing all the core features like school-wide. You can implement it class-wide. There's so many things to do just to really boost morale and climate and culture within your classroom, and then use that to encourage your administration to do it school-wide.
Another question was, as you mentioned, we all experience the anxiety. Any advice for administrators in helping their staff dealing with their own anxieties?
Yes. So this is a big one. We all have anxiety, and it's worse since COVID. I really believe that. And I know that there are teacher appreciation days, and we have our bosses tell us, take care of yourselves, but also check this email and do this by this or that time. You need to have boundaries for yourself. I took vacation last week, and I refused to answer emails. That was really hard to do. But you have to make boundaries for yourself. So as administration, acknowledge your staff. just like we need to acknowledge our students, we need to acknowledge our staff more. Not just a teacher appreciation day or a week once a year. When we see good things happening, rewarding them, giving extra resources if you can. I know that's so difficult, but also just giving a time and space for teachers to be able to work with each other and vent and talk about what's happening. Don't just admire the problem, but work towards a solution. I know a lot of times teachers really just need that collaboration with each other, that validation. So I would recommend that. And for students, I know Kathleen Strickland-Cohen is going to be talking about de-escalation later today. She wrote a phenomenal brief on that, and she is a phenomenal speaker. You guys will love that. But one of the things that happens with de-escalation is when our students are in crisis, it causes us stress, and we don't get the chance to come down from that. So as administration, if you have a room clear, know that that teacher is going to need some support. That teacher is going to need some time, 5 minutes even, to just take a walk and get away and gather their thoughts back together. Little things like that really make a huge difference. And I think we forget about that. We're so worried about the students, but we need to support the staff and make sure that the staff is okay with that student coming back in. Hopefully they have a good enough relationship that that's okay, but it might be that you need to cover them for 5 or 10 minutes. It's really just a lot of little things that we have to just really be intentional about in our day to really support our staff. Also, providing free massages or something like that would be great. There's not a really one great answer to that because it's so multifaceted, but those are just some things off the top of my head.
So a couple other things that came up in the chat. They're wondering if you're familiar with Leader in Me, Trails, or Character Strong, and if you know if any of those deal specifically with anxiety.
Yes. That's my answer. Yes. What was the first one?
Leader in Me.
I don't know Leader in Me. I know Trails.
And Character Strong.
And Character Strong. And those, Character Strong is more character ed, like respect, integrity type thing, which I think is beneficial. It's not necessarily specific to anxiety, but Trails, I believe, is. Also, I have anxiety, so having to think of things on the spot, my brain isn't like, in 10 minutes, I'll think of all of these answers and be like, oh, I know that.
You're doing great.
Thanks. Thank you.
Not a question, but just something that came up in the chat that I thought was good to bring to the room was someone reminded us the Michigan Model for Health is a great free curriculum that includes SEL in all units, evidence-based comprehensive pre-K through 12th grade lessons. So since the people in the chat got to see that, I wanted to make sure people in the room got to hear that as well.
There's a lot of great curriculums out there. I put just a few up here that I know and I'm familiar with, but there's a lot of really great ones. I would just make sure that everything is evidence-based because there are some curriculums out there that are free but not necessarily evidence-based, and I think that's important to consider as well. I'm a data person. Yay, data. I like the data to show that it is evidence-based. Anything CBT is evidence-based, so think about that as well. Any other questions?
I'd like to ask a question. I'm over here.
Hi.
So I'm just curious to know, in your practice, have you noticed a shift in the way secondary students are perceiving just the idea of anxiety and therapy, compared to maybe a couple generations ago?
Yeah, I think the term is used a lot more. And I think I said at the beginning, like sometimes people use the term willy-nilly, like I have anxiety, without really understanding like the biological, the physical, all of the components of it. So I do hear students like say these terms a lot more, but I don't think they necessarily really understand what they are. So even though I think they're using the terms, I really would encourage us to like talk about it more, so that they really are understanding those terms and what it means, and that everyone experiences it. It's used for survival, that we can't eliminate it, we just have to manage it. I think the more we talk about it, the less stigma there's going to be, and the more good information we get out there is going to be beneficial. I work in an alternative school 1 day a week, and they refuse to talk about any of this stuff in groups. I have to talk to them individually, and I have to give them time to like warm up and get to that point, because every child in that alternative school needs social emotional learning. That's why they're there. But they're so resistant to it because of the stigma about it, and so it's. I say this about everything. It's all about how you frame it. It's all about how you frame it. It's not a stigma. It's something that we all have. It's not counseling or therapy. We're just talking about some skill learning. It's really all about how you frame it. Yes? Absolutely. So, using those screeners, like before, during, and after, I think is really beneficial. And also measuring, excuse me, sorry. So like my dissertation was modifying cognitive behavioral therapy to address anxiety in children with autism. And one of the things that I measured was the behavior specific to the anxiety for the individual students, which took some time to figure out. But if it's avoidance or escape, I figured out how long, for example, starting a task is often avoidance or escape. We're reluctant to start something that's going to be difficult, so I would measure how long it took for them to start the task. Here's the direction for the task, and then I would measure how long it actually took them to get started. Or once they started the task, how long it took them to get to the avoidant behavior. You have to be a little creative with it. You can measure heart rate and cortisol levels, but who has the equipment and the resources for that? I also did the emotional thermometer, so measuring their ratings on the emotional thermometer, kind of keeping track of that each day and then at different points throughout the day to look at how they were doing. So there's a lot of different ways. You can do the rating scales. Looking at that behavior specific to the child takes some figuring out and takes some time to do. It was a lot of conversations with the kid, with the child, and with the adult to figure that, the parent to figure that out. But it was one of the best measures that I was able to do, which would not be a tier 1 thing. It would be definitely like a tier 3 thing in that situation. But yes.
I wanted to know, at what age have you found that it's most important to get a medical diagnosis for anxiety, or when is it most developmentally appropriate, do you feel, based on your research and your evidence?
Well, I'm not a medical doctor, so I don't want to really speak to that too much. I know we have preschoolers that definitely have symptoms of anxiety. But then that anxiety, that it changes as they grow. And so I'm reluctant to answer that question. I do think we definitely see signs and symptoms of it in childhood, in early childhood. I think we just need to really be sure, again, that we're looking at the whole child, we're getting the whole picture before we pursue a medical diagnosis. If it's applicable, it's applicable. But even if they don't have a medical diagnosis, we all still do struggle with anxiety. And so it's good to teach those skills, those curriculums, to be aware of that. I'm sorry, that's not a great answer.
Well, I just asked because, we don't diagnose in the school system. We provide services and interventions and supports. And so there's always that medical model and educational model. And, we have to talk with our families about that sometimes when there's no diagnosis, it doesn't mean that they're not struggling, but there's just not a formal label for that problem. And that's why I was just wondering. Yeah,
that's a really great question. And I think that was part of where my passion for this came from, is that I would have students, I worked with students with disabilities, and I would see that they would have difficulties, but a doctor would see them and say, oh, they have autism, I can't touch the anxiety, I'm not touching that. And so that's one reason why I believe it's really important for schools to address that. Because we can, because we're here to teach all children, because it affects all of our students, often in schools. I had that conversation many times. Like there is that medical piece, there is that educational piece. That's why I also really like the interconnected systems framework, because there are clinicians outside that we have relationships with, that we have an understanding with. Like, can you tell me why you did or didn't give this diagnosis? And can I tell you why this affects us at school? Having those relationships, I think, are really, really important. That's a great question, and I totally understand where you're coming from. I'm just a little reluctant to give you a hard, fast answer.
I hear you.
Sorry. I'm not sorry. That's my story, and I'm sticking to it. Yes.
I just want to piggyback on that piece too. Some of what we're seeing too is just lack of skills. And so before we do a diagnosis, it's so important to make sure that we've done the universal strategies first and to ensure that the skills are in place and to see whether that anxiety lessens or diminishes at some level. And so that's where my hesitancy is too, especially early childhood with the littles. Sometimes it's just a skill deficit that can be easily
Addressed.
Thank
Yes.
you.
100%. All right. You have had wonderful questions. You were delightful, and you gave me water, and you clapped and laughed at me, and I appreciate it. I appreciate it so much. I'm giving you a few extra minutes for your break. Again, the PowerPoint has lots of resources and links in there, but if you have any more questions, please feel free to email me. I am happy to share resources, briefs, research articles, curriculums, whatever. So thank you.
Thank you.